Hi, everyone. Welcome to this week's What's Up Wednesday. Today, I am joined by Leslie.levine and Alex.andrews with 365 Health. They're going to be going over their comprehensive program and explaining kind of how impacted childcare centers and families are when a provider needs sick time or needs to seek medical care. So, hi, Leslie and Alex. Thank you so much for joining me today and welcome.
Thanks for having us.
Absolutely.
Thank you.
So, go ahead and kick us off today by explaining your roles with 365 Health today.
So my name is Alex.Andrews. I'm the Director of In-Person Programs for 365 Health. We were formerly 9Health Fair. So people might know our 9Health Fair since 1980. We've been running those in the state. And we are a nonprofit offering health screenings and education. And we have some new services as well that we're going to tell you about today. So that is a little about me.
Great, thank you. And I'm Leslie.Levine. I'm the Business Development Manager for 365 Health. I have a really long background in chronic disease prevention and really working with communities to help them address the barriers to accessing physical activity and healthy food in their communities. And so I'm really excited to bring that background and that experience and those relationships to 365 Health, so that we can address the barriers to accessing preventive health and medical care.
Awesome. Thank you both. I'm glad you kind of mentioned the name change. So what does that name change mean for the partnership with 9 News, just to get that part clarified?
Yeah, I'm glad you asked that question. So this just happened for us this week, actually. We officially rebranded to 365 Health from 9Health Fair.
Okay.
And so the partnership with 9 News is not changing. They are still our major media partner, very supportive of the work that we're doing across Colorado. They still want to help publicize health fairs and our new services that we'll be talking about. This really just happened because a lot of people think that we are one and the same, that we are 9 News. So most people refer to our health fairs as 9 News Health Fair. Yeah. So we really want to be able to have our own identity, be able to approach funders and other partners and have them know that we are a distinct organization, a distinct nonprofit. But 9 News is still very supportive of the work we're doing.
Got it. Okay, that's super helpful. Thanks for that. So to give the industry watching today just some background, go ahead and frame what today's topic is, or kind of what drives the need for that access to medical care and what the resources you have provides.
Yeah, so Leslie, I know, can dive into this a little bit too. Really, we have found that, with our history and our mission at 9Health, the National Health Institute started this model of health fairs that we ran on in the 1970s. And so there seemed to be, a high kind of gap for individuals actually reaching the screenings and the education they needed to make preventive health decisions about themselves. So that's how it started in the 70s, and it still seems to be a need, that there's a gap there for people. And Leslie, I know, will talk more about our digital health services, so you can frame that portion of it as well, Leslie.
Great, thank you. Yeah, we were really excited last summer to launch our Health in Hand program, and we're partnering with employers to really give them an affordable option to, as I said earlier, increase access to preventive care and medical care. And so we want to give the employers the opportunity to show their employees that they really care about their health. And at the same time, we want to show the employees that there are ways that we can make it more, I'm sorry about that. We want to provide them more flexibility with accessing the medical care that they need and really save a lot of money when they're doing that. And so we work with both employers and individuals to bring the Health in Hand program to them. So we're really excited that just 2 weeks ago, there's been so many changes at 365 Health, but about 2 weeks ago, we released this program for individuals and families as well. And that's just going to be a huge game changer, especially those who are working in rural communities where we know that people have a really long drive to get to medical appointments, or, maybe there's just not a lot of medical providers in those communities. And so giving people really quick access to doctors is going to be huge for people living in those communities.
Yeah, absolutely. So what are those health fairs and clinics that you offer?
Yeah, so I can talk more about the health fairs. So I was diving into my position a little bit before, and now we'll go a little deeper. Since I'm the in-person program director, I'm overseeing the fairs that we're going to talk about here in a second. And we have some other stuff, vaccine clinics and special events. There's all kinds of ways that we're trying to get right at these community members, wherever it's convenient for them. So we have this fall fair season coming up, and they are all over the state. We're primarily focused that first weekend of September 24th and 25th in Colorado Springs, Mineral County, Glenwood Springs. And we have 5 fairs running that first weekend. And I know, Milana will be sharing out kind of links to where people can access the exact location. So really had a lot of different public health departments that were excited, and other community partners that were excited to get back to serving people and meeting their needs when it's convenient, when and where it's convenient for them. So they just, with that lack of kind of access to medical providers during the pandemic, it was very obvious to these different partners that we have that we need to get back to serving community and making it convenient for them.
Yeah, absolutely. I'll include those links either in the description of the comments on the platform they're watching. So I've been hearing a lot about the Health in Hand program. So what is that, and kind of why is it relevant to the providers?
Yeah, so I'll kind of break down what Health in Hand is, and then talk about why I think this is such a great fit for childcare providers, whether you're working in a center or you're a family childcare provider. So there's 3 elements to the Health in Hand program. So one of them is a blood screening. So we really want to help people identify their risk factors for chronic disease. It can take a lot of time to treat those chronic conditions, and it can take a lot of money. And so if we can help people prevent them in the first place by having that annual blood screening, that's really important. The second piece is we're a really reliable source for people to access health information. So whether they go to our website and look at videos and blog posts or do some health assessments, or they're looking at the monthly emails that our members receive, those are some great ways for people to access that reliable health information. And then the third part is an on-demand text-first telehealth service. So Milana, are you familiar when I say on-demand and text-first? Do you know what that means?
Kinda.
Kind of. All right. So it's pretty different from what a lot of people experienced during COVID, likely for the first time, is people were able to suddenly make appointments with their primary care provider. They found a quiet space, they did a video call, and then they paid the copay for that service, or they paid out of pocket if they didn't have insurance. And so that gave people a lot of flexibility, but you still had to have time during those clinic hours, during those office hours, and you had to have a quiet space. That is really hard for childcare providers, right? And so the idea of on-demand telehealth is it's available to you 24/7, 365 days a year. So you're getting ready for work at 5:30 in the morning because the center opens at 6, or your family childcare home opens at 6, you can easily pick up an app and chat with a doctor or text with the doctor before you start your workday. You can do it on a Saturday evening, weekends, holidays. So it really adds that level of convenience. And these are primary care physicians, emergency room doctors, and psychiatrists. So not only can they help with medical conditions, the physical health conditions that you typically would go into a clinic and receive those services, they can also help with behavioral health conditions. And so having that added flexibility when, as a childcare provider, you've got really long days and all of your energy is going towards taking care of those families. So having that flexibility so that you can actually take care of yourself too, I think is really important for the early childhood sector. And then also we know it's hard to take time off. It's hard to find substitutes, right? Hard for centers and really hard for family childcare providers. So if we can decrease that need for substitutes, because people can seek that medical care whenever it is convenient for them, that's really big. That's really
Absolutely
big. I think it would be really helpful.
Yeah. Awesome. Yeah. So we all know people like testimonials and kind of the feedback that kind of comes around and goes around. So do you guys have any touching stories or impacts that you'd like to share with the people watching today?
Yeah, I can start with a couple, and Leslie may have some more related to Health in Hand, but I've got a personal one for me, and then also one that we've heard from participants. So I don't know, some of your listeners may not know about all of the blood work that we offer. So most people are coming for what's called basic blood chemistry screening. It's a 28 panel blood screening. They can get it done at our health fairs. We also have this wonderful partnership with Quest Diagnostics. And so over the pandemic, we weren't running fairs, and people can also now go to Quest Patient Service Centers. So they opened up their service centers to help still serve people, make sure they can get the same great prices they're always used to getting from us. So when I first got my blood chemistry screening, I just, I was in my early 30s, and you just didn't have a health scare yet. I thought I was fine. I didn't need to know this. I'm just going to do it because now I'm working for 9Health. And so I got mine, and I see that I have some data that's really off, and I find out that I have something called Gilbert syndrome. It's French, so it looks like Gilbert.
Gotcha.
It's Gilbert syndrome. And so I start talking to my doctor about this, going, what is this? And basically I'm like a baby with jaundice, and I have really high, my liver is kind of on active overdrive all the time. And what do I do to control this? How does this affect my, and I had no clue. I had no idea. So I think that it's just really, for me, a really good personal testimony to say to people, you may not think you need to know about what's going on with your blood, what's going on with other parts of your body. But when you have that lack of access to information and resources, you don't know what you don't know.
Wow.
So that one was really important to me because, like I said, I just did it because I started working for 9Health, and I was like, oh my gosh, everyone needs to do this. And then the other story that I wanted to tell, the other testimonial, was about one of our participants. She went to one of our health fairs, and we have a whole slew of different screenings that people can get. And we have wonderful medical volunteers across the state that offer their services and their time to come to other fairs and offer these screenings and education. So there's a giant list of screening options. They're not all the same at every single fair, so I'll just caveat that.
Sure.
This one particular fair, there were breast exams being done. And so there was a woman that got a breast exam done. The provider there, just to also let people know, they're not diagnosing, they're not treating at our health fairs. They're giving screenings and education, letting women and men know, letting people know when they come through and access these resources, they're going to give you referrals. They're going to give you education to make sure that you have the details you need to know to follow up and stay active, stay on top of whatever the concern is. So this particular woman found, the provider found a lump in her breast, and she gave her some resources to get follow-up, and it was cancerous. She ended up seeing a provider. They caught it nice and early, and so this participant was just so eager to get back to that provider, that volunteer. So we had to do a lot of work to find that provider, and we got this beautiful video testimonial of the two of them. But it was just a testament to how much we need these volunteers and how much our community needs these fairs to understand what's going on in their body and catch things early.
Wow, that's incredible. Leslie, did you have anything to share on that one?
Yeah, sure. So I can also share my experience, focused on that on-demand telehealth. I have used it so many times, starting a new job. I was really hesitant. I mean, I work at 365 Health, but I was still hesitant to take time off to seek medical care. And so I've used the telehealth app a lot, asking, of course, questions about COVID, when should I get the booster, things like that. And then I was, out of town, staying in somebody's house, totally smashed my foot on some chairs that were stacked in the hallway. And I'm thinking, do I need to go to the emergency room? Do I need to go to urgent care? Did I just break my toe? And all I had to do was snap a photo. And the doctor was like, no, just ice it, elevate it. If it doesn't look better in a couple of days, come back to us.
Right.
I mean, so for me, it's been really convenient, and I didn't have to take off, sick time at the beginning of a new job. So it was convenient. We do have a member, she is a realtor, and so she, has a really high deductible health plan, and she also was struggling with depression. And so, it's what do? I don't want to be paying all of this money, but I really need to take care of my health. And she was able to utilize the telehealth service to get the care that she needed, to get the medication management, to get some assistance from the doctors on some behavioral things that she could do to make sure that she was able to address her depression. And so it was a big lifesaver for her, because she didn't have to be so worried about the money that she would be spending every time she needed to visit with a doctor. And so, that's just one example of the way that people can really benefit from the Health in Hand program. I should mention that we are a nonprofit organization. And so I like to say we're not making our millions off of this. It's priced at $99 a year. And so it includes that blood screening that Alex has been talking about. It includes the unlimited access to the on-demand telehealth, and then all of that really great health information that can help people take small steps towards healthier behaviors. Because overall, that's just what we want for Coloradans is how can we help people live their healthiest lives?
Sure. All about helping. I hear you. That's awesome. Those are some great stories. I love to hear those. So for anyone that does have questions or wants to learn more about the topics we covered today, do you have any extra resources you want to share, or for those watching, and where can they go to ask questions?
Yeah, so our website is definitely the best go-to place. So we've got health fairs listed there now. Health in Hand is also listed on the website. So that's a great place to start. People can always reach out to me and Leslie, email us and let us know if you have more questions. And Leslie, I don't know if you have more places you would like to guide them to.
Yeah, definitely the 365 Health website. Just click on Health in Hand if you're an individual who's looking to purchase our healthcare option, or if you're an employer who wants to look at providing this for your staff. There's some different links on there that will just give you the information that you need.
Awesome.
And so I'd be happy to work with employers and help bring this to your employees.
Awesome. Well, we'll wrap it up there. If you guys have any other final thoughts, updates, or feedback regarding 365 Health or just to the ECE field in general, feel free.
Yeah, so I think the one thing that I would like to say, just knowing the kind of work that all of you are doing and working with people so young. I know I actually used to work in early childhood education right after I got done with my degree in Fort Collins at CSU. I worked in an infant room. And so I know how hard it was to keep up with my own health. And the way that I think about it now is what a role model I am being to the young people around me, whether it's my own kids or the kids that I'm taking care of, and the people that I'm around at the fairs now, since I'm working at 365 Health, that I want to show them how to model, good self-care. And so we're really hoping that they can utilize our services and be well for themselves and show kids early on in life, this is how you do it and how you do it well.
I love that.
Very well said, Alex. I don't think I knew that you worked in an infant room.
That's so cool. I didn't either.
I mean, I'll say my kids are grown, they're adults. But I still remember how much energy it takes to run after toddlers. And so we just really want to help people be healthy, have the energy that they need, be, fully present when you're on the job, because the work that the childcare providers are doing is so important to help those little ones develop healthy minds and healthy bodies. And so we really want to partner with you on that journey and make sure that you have easy access to the health resources that you need.
Absolutely. Well, thank you both so much. Truly appreciate your time today, and we'll see everyone next time. Have a good one.
Great. Thank you.